Hello, this is Dr. Vasquez from G Health Enterprises. I just wanted to take the time to reach out to the rest of the teams. We're going to use this almost like a town hall meeting once a week. And there'll be questions. This one I'm doing, while it says live, I'm not doing it live this time as a test. We're going to send you the link, and then we'll let you know when we're going to come live. And all you got to do is click into the link that we'll send you. There'll be questions. What we want to do is keep everyone updated as to what we want to do during this whole process. Also letting you know that, we're going to get over this thing. I mentioned this week coming up and the following week is when we have New York getting hit. We're going to be probably 4 weeks to 5 weeks away. So we're trying to get everybody kind of aware of what's going on. I sent you a couple of videos that were actually pretty good that talks about the epidemiology and how this thing works. For those that went through it, this will be a little review. For those that haven't, this is just a short version of what you got. So this virus comes into your lungs and it affects a particular type of cell in your alveoli, which are the air pockets in your lung. It's actually what they call the pneumocyte type 2 cells. And there's a receptor in that alveoli called that basically is an angiotensin converting enzyme type 2. And that's where this virus can attach and get into the cell. The reason that that's important is as we start looking at mechanisms, this virus, which resembles what I believe the Spanish flu did, was the difference now is we have IT and we have knowledge and we have medications that work with that. And that's what they're talking about, the Plaquenil, the chloroquine, the hydroxychloroquine. These are the drugs that are going to work there. And we find also that there's a lot of superinfection that happens with this. And so you get these bacterial infections. So patients often present with a fever when they're first exposed to the virus. And that's why it's so important for you, if someone feels they have it, to take their temperature, because that'll give us the first clue. You want to rule out the flu so they're going to have some testing for that, and that is available. But once they start developing cough, that's when these viruses start to kind of grow. Macrophages come into the alveoli, and then you got neutrophils, and you got this whole consolidation of pneumonia that they're heading towards. So cough leading to shortness of breath and chest pain is where we need to be kind of there to let these patients know that there is regimens of treatment and we got to find a way to get them tested. So the rapid testing we should be able to get a hold of in the next 2 to 3 weeks. Now, New York peaks next week, this coming week and the following week. We're going to be peaking in about 4 to 5 weeks. So we're hoping to develop a plan to take this fight to the streets when it comes to treating this virus. And I think it's real important to do that to really make sure that our community doesn't get hurt. Now, one of the things that happens with this particular virus is when you get it, you can often infect 3 people. So if those 3 people affect 3 people, that's 9, 27. You can see what the problem is. And I think the best advice here is let's infect 3 people ourselves in terms of the knowledge and information. That if people are in the homes, assume they have it and try to isolate anyone over 50, 60 that has lung disease like COPD, emphysema, asthma, heart failure, heart attacks, diabetes into a separate section of the house if you can. Again, we not only think that it's airborne, but it's also fecal oral. So it could be when you use the bathroom, if you don't wipe your hands, that can also be a way of transmitting this particular bug. And it stays around materials, so plastics and stainless steel. So your phones, anything that you have, you should be wiping those things out once a day, not sharing cups, not sharing knives and things like that, because it's going to be a real issue coming up. I want to thank all of you guys for really helping through this process. I think every team has really stepped up. We're trying to get the navigators to get more information, because as we get deeper in the weeks, people are going to have trouble with regards to getting food. And that's what we're trying to plan it out so that we have enough and be able to kind of get the actual meds or food to these individuals. I know that outreach has been working with wellness and also working with member services and transportation to really do that, and they've done a really good job. The one thing also, besides the isolation, and I just did that, is we often touch our face 200 to 300 times a day. So it's real important to wash your hands during this whole process, okay? It's real important, because if you get it around the eyes, the nose, and the mouth, then you're going to have it actually reach your nasal passage, reach your lungs, and we get into trouble. So that's one thing, even for all of GBON, that needs to be sort of, and Jibaco, and Urban, and G Health, all these it's important to get that information out there. I know that we've had some members and people within the G Health system that have gotten sick with this. So, my prayers are with them. And make sure they're going and getting the right information through this process. I need feedback. We want to have these town halls on a weekly basis to keep everybody informed, calm everybody down. I know everyone gets anxious now because you're home and all you watch is the news, and all that does is get you more depressed. So watch some good movies and try not to focus too much on this all the time. Try to help out with the members, especially the navigators, the 80 to 100 people that you manage. Real important. Member services, if something comes up that doesn't work out, let's not wait till things get worse. Let's make sure we address the issue, talk to the administration, meet as a team. But this is a battle we're in. We're in a deep battle for the next 5 to 6 weeks. And we'll let you know week by week what we're trying to attempt. We're trying to do something out in the community with a set of a lot of other providers to expand the telehealth. We went telehealth when we did, but a lot of other entities weren't equipped to do that. So as a health home, GBON, the telehealth is really good. We want you to use a lot of the video visits if you can, because it's going to be real important. And you're setting the stage for what we want to do in the future. Urban, with their telehealth models, are actually already there. And so we're working through a lot of different things that most people didn't prepare for. So you've got big groups right now that are really not working and seeing patients. We're trying to develop a telehealth model to incorporate them. If we run into problems with the community as a plan that we're trying to push to go after individuals that may not have primary care, is to really set up telehealth platforms. We're trying to get the rapid screening tests, hopefully in the next 2 weeks, to be able to screen some people. And we're looking at it, trying to even setting up hotel models to treat a lot of these individuals that will not be able to go. You don't want them all in the hospital, to manage them there and also get them, find out who really needs to go to an ICU and who could be managed outside. I think it's our responsibility as primary care to make sure that we're looking out for the community and not just let the system kind of take over. Again, it's just, we're going to do these once a week. I'll send you a link. This one says live, but we just recorded it as a test. We're sending everybody the link. But during the week, I'll give you a time where it's going to be live, and then you can have our questions that'll come in, and we'll be able to answer them on the fly for the group. But again, I want everyone to know that we're going to get through this. I think we've been planning. Our systems have already been equipped. The difference between the actual Spanish flu that happened back then and this now is IT. Technology is going to be real important. And we understand the mechanisms, and there's a lot of drugs that really work on this. What I fear is that after the curve comes down, we may get another surge in the curve sometime in September and October. If that happens, at least what we're doing now will be prepared for that. So again, everyone at G Health was maintained. We didn't let anybody go. And I think it's real important to know that we're fine. We're going to keep going and everything's okay. So you don't have to worry on that end. What I do want you to worry is about the members and the patients that are part of our system. Go that extra yard sometimes, okay? I know that sometimes you say, well, I already do enough. I think if you can't, for me, just during this time, everyone kind of needs a little help. And I think they also need a little hope. And as Americans, we need to kind of really work together, and it's important, okay? Thank you.